Hey, igniteDDS. My name is Patrick Fitzgerald, new graduate dentist. Been out for about 6 months here. I have on the phone with me a current fourth-year dental student at the University of Florida, Violet Laurie. She just got out of school. Say hi, Violet.
Hey.
Awesome, cool. So we're just going to discuss a little bit about AEGDs versus GPRs versus private practice. She has some questions,
Yeah.
so I figured it'd be cool to record it, and maybe it'll help someone else. So if you guys are questioning or really struggling, this is something that I personally had to fight with a lot in my head about. So I'm
Yeah.
really personal and passionate about this topic. So hopefully it'll
Yeah.
help everyone. So all right, Vi, so go ahead, girl. Just
Okay.
tell me what's going through your mind, I guess.
Well, basically, I was also struggling with the idea of whether I wanted to start working or going to an AEGD. And I think a lot of people were telling me, do an AEGD. That's one thing I regret not doing. I heard from older dentists and all that jazz. So basically, I applied to 4 programs, not too many. 3 of them being pretty competitive schools, and one of them being like a newer program in Tampa, which I had hardly heard of. And of course, I get the interview to Tampa only.
Mm-hmm.
So about 2 weeks ago, I went on that interview, and it really did not sit well with me.
Okay.
And I knew that if I got in, I would be binded by the match contract. So it was a really hard decision, really hard, and I turned it down.
Okay.
Because I figured, I get out, maybe for my first year, and maybe I will feel lost. But this program said, we're only doing bread and butter dentistry. We're going to refer out pretty much everything complex. We're not doing implants. We're barely doing any perio, anything cool. No pulpotomies for kids. So it was very, very straightforward dentistry. And while I'm probably not completely efficient in that yet, I figured I'd rather get out and struggle my first year a little, and make about 6 times the amount struggling than sitting halfway through a year of residency and not doing really anything too cool.
Yeah, or banging your head against the wall.
Right, and they said you'd be doing a lot of perio, and I pretty much almost walked out of the interview at that point now.
Yeah.
No, just kidding.
No, yeah.
But I was like, geez. Okay.
Gotcha.
And I'm like, oh, you mean like reflecting claps and doing SRPs? Like, she's like, no.
Oh, man. Yeah.
No. So
Bummer.
basically, right now, at this point, I'm pretty sure corporate's the way I'm going to go.
Okay.
But I'm also pretty nervous about that. So
All
I
right.
saw your video, and you said that there was, like, this website that we could go on and, like, pretty much get the help we need.
Yeah. It's
when we're feeling alone.
Yeah, Spear Education. They've got a good program with igniteDDS for new grads, just like yourself. And I guarantee you, if you looked into it now, you might even be able to get early access to it just to, feel it out. And that can give you some good guidance there. I was lucky enough.
How do you get on there?
So I know that Dr. Rice, I was actually going to call him today earlier. I'm going to do that actually with him, and heck, I'm going to make a video like this talking to him about how new grads can log on. But I initially started out with Spear Education online through my mom. She had an account, so I just went and checked it out.
Yeah.
But the cool thing is I purchased an account with it for a year long. But right before I graduated, and I know this is going to sound crazy, it was about $1,000. But that's for a year-long membership, and
So it must be pretty good.
Oh yeah, and you have so many resources on there, and that's why you can check it out for free before you buy it. That's their thing with igniteDDS, which is cool. But they have everything from occlusion, TMJ, perio, implants, like pros, a ton of pros, full mouth rehabs, equilibration, everything that Dawson and Panky talk about. I had an equilibration case, and actually Dr. Howard at the University of Florida, I was going to do it with him, and I got on there and I watched about 8 hours worth of videos, and then when it came to meeting with Dr. Howard, I was ready to go. I was talking about lucia jigs and everything else, and things that they hadn't even taught us about in school, and it had changed my mentality, the way I viewed a lot of stuff, and it just gave me so much more confidence when I was even explaining to my patient why her bite feels off after some other dentist pulled her first molar. Everything was fine, but then she pulled that one tooth, which ended up being
Right.
her initial contact in CR. And you think none of this stuff matters in dental school when you're going through the physical exam and you're going over all these things, but then you realize and you start seeing cases like this and it blows you out of the water. And then
So,
and if you don't have a resource like this, you don't know why.
yeah.
And,
My big thing is, like, if I get out of practice next year, and I talked to Dr. Young today, and he said, not doing that AEGD or going maybe corporate, you're not going to be adding to your knowledge base at all.
yeah.
And I want to be adding. So I kind of wanted Spear to help hopefully be like my own AEGD.
Heck
I don't know
yeah.
if it goes that far.
I know. I love that. No, that is the mentality that I have had for the past 6 months in private practice. I compare myself to everyone else doing AGDs and GPRs, and I know that I don't know if that sounds cocky or however you take it, but I just take that as a personal mentality of my classmates are getting some incredible education and they're paying for it, and I want to be able to keep up with them. So how do I do that? I get out and work, but I also come back in, and I know when they're studying for exams or they're studying, I'm coming back from work and I'm studying for 2 or 3 hours a night. And if you don't have to do that every single night, just do that 2 or 3 nights a week. Okay, invest 2 to 3 hours, and then the cool thing is you invest those 2 to 3 hours. If you do it with Spear, those get logged into your CE. If you're like a member with the Academy of General Dentistry, so that can count towards a fellowship, or you can report it as your CE, and you're just sitting in there watching, taking notes, and developing your mind. And that's the big thing is you want to keep progressing, even if you. I'm so happy we're talking about this now because. When you get out in private practice, it's so easy to get caught up in your niche of just doing a bunch of fillings and then being exhausted and you aren't learning, or if you're a composite slave for some corporate machine, or even a GP. I came in one of my opportunities, I worked for him for 3 months. The non-compete clause started after 3 months, and he accepted all these insurances. He was doing all the fun crowns and implants and even extractions and got to see all the emergencies. You know what I was seeing? I was seeing the Medicaid fillings. I was doing like just all of the fillings, and initially he was paying me based 35% of collections or production. And that was just, I did so many fillings and I was barely making it, and I told him to switch me to a guarantee of at least 500 a day. He had to think about it, and then he eventually said yes. And I said, I want production instead of collections, because my collections was based on the girls at the front desk. I mean, they're sweet ladies, but they barely had a high school education. So you're telling me my paycheck as the doctor was relying on these girls to send in things to insurance? Are you kidding me? So, I mean, and he even told me that he felt like his staff was pseudo-incompetent at the front office desk. And I was like, listen, you're telling me to trust you? And he eventually did that. And I eventually, got a few more crowns once I realized my guarantee. But I would show up on a Saturday, only see a couple patients because people canceled due to their lower socioeconomic status, and they just weren't invested in the appointments. And I'd only get paid, $100 to $300 for sitting around all Saturday doing a couple fillings. And I was like, this is not going to happen. I need my base guarantee. And you can modify and change. Like, I had a contract with him. You can modify and change things. But, I really wanted to stay out of corporate for a while and just do private practice. So in private practice, I held that job for almost 3 months. I was part-time with him a day and a half a week, and then I was doing 2.5, 3 days at another office, which I've actually stayed at for the longest time, and I'm actually about to move to Virginia Beach, and I'm going to do another, spiel about that awesome opportunity. It really fell into my lap, but, just doing these different jobs, and honestly, being part-time was so cool because I was able to see how different doctors worked. But back to our initial point, if you're going to be out and working private practice, whether it be corporate or in a private office, you got to get involved in the local dental society because they do a ton of CE, but they're also like local, like down here in South Florida, we have the Atlantic Coast Dental Research Clinic. If anyone's down here, you basically can sign up for all these incredible courses. They meet 1 day a month, all day long. For like first 4 hours it's lecture, and second 4 hours it's hands-on, helping do patients. So like I'm taking a perio class. So first thing we'll do is like go over aesthetic crown lengthening, and then the next 4 hours we're doing aesthetic crown lengthening with a periodontist. They're teaching us. Like, you're telling me, like, that is incredible education, and it was affordable. As a new grad, I got to take 2 classes for free. And people drive down from Orlando to take these classes. And you know what the cost was for? It was 8 or 9 sessions divided up over the year. It was $250.
So what is this your specific local?
Yeah, that
association?
yeah, well that was just within our, that was like a little, that was at the community college close by. Like that was just it's called the Atlantic Coast Dental Research Clinic. That was just a research clinic that they offered the CE, but even by going to my local dental, like my ADA meetings, I would get CE by attending those meetings, and I looked around, no new grads at all. I was the youngest person by 10 to 15 years. So I got to network with all these older doctors, get to know them, and they would even say, "Hey, if you have any free days, come by the office. We could use someone on Tuesdays." So you could even work on getting a job through that. And oh my gosh, getting to know specialists through those meetings, and it's usually, at least down here, it was a lot of specialists, not many GPs. Those are some of the best guys because they've been around for a while and they know the GPs in the area, so they know who's looking. So, and you want to be with someone that's involved like that.
Yeah, I definitely realized that I have to, one, find a way to literally keep learning.
Yeah.
And 2, to know other dentists and get myself incorporated into the area.
Yeah, networking is huge. Yeah, networking is just insane. I know, I just sharing my experience. I know it's kind of late for you in this aspect, but it might be useful for others. I was kind of in your place 3rd year because that's kind of when you're making that decision. And I just realized, you know what, I'm going to learn as much as I can at school. So I was always in the specialty clinics, perio, oral surgery, endo, shadowing a ton when I didn't have patients because I was like, I'm going to treat my 4th year like a residency. I stayed there all the time. I did not get out early. And I absorbed all my information because that is free education right there.
I really wish, at the second that, I wish I did that 3rd year when you had all that free time.
But you know what? You still have 5 to 6 months. That's half an AEGD residency right there. If you get off of it, I know you're getting ready for boards and stuff now, but I mean, what do you feel uncomfortable with? How's molar endo? No? Go sit in on molar endo with the residents. And ask them questions. Be like, so, what if an emergency rolled in? What would you put in the canals? What if this happened to the canal? Just casual conversation while you're assisting them. And that is just some awesome education. Would you put calcium hydroxide in here? What if you didn't have calcium hydroxide? These are all just awesome. Form of creosol when in pedo. And the cool thing is, I learned a lot of, I was doing a pulpotomy on one of my best friends' kids the other day, and I actually posted on my little Facebook page and did a filling, and no pain at all. Kid didn't even feel the injection. I felt like a hero. It was awesome. But they told me the night before what happened. I popped up my little pedo chart here and just did a quick review. I knew take out spec pulpotomy within 2 hours, but it was more so 12 hours, but took out a little bit more, made it work, monitored it, and he did great. And, just reviewing procedures, and you want to talk about a learning experience, just doing that. You've been taught everything. You have it in your notes. You have the education. You might not have it memorized, but the best way you're going to learn it is by doing it again and again. And as long as you're doing it right and you can be confident in yourself. You got to be confident to do it with patients, but you have to be smart too. Don't get yourself in trouble. You can take out 3rd molars if you're used to laying flaps and doing some surgery, but if it's swimming near the inferior alveolar nerve or, you're uncomfortable, then, you send it out and it's just a baby step thing. I did my first case or 2 of posterior crown lengthening, but that's because I've been doing this perio course forever and they were teaching us about aesthetic crown lengthening, and, I've watched it and as a 4th year multiple times, and if you can develop a flap and extract a tooth, you can do posterior crown lengthening. So.
That's true.
Yeah.
Can you think of a couple times, or at least one time, where a patient came in and you literally didn't know what to do? What you did?
There was like one or two times where, someone would come in as an emergency of pain, and it would be like another doctor did a crown on the tooth, or like a temporary crown, and I didn't really want to mess with it because they were having a bunch of like more so facial pain, and it wasn't swelling more so, but it was more so along the lines of like Dawson education, like where it's having TMJ and muscle issues due to their initial contact in CR. And it wasn't the fact that I didn't know what was going on. It's I didn't want to mess with it because it wasn't my work. It was in the temporary. So I actually went and got the other doctor that did the treatment to go in and check it out. And he just adjusted everything and on the crown. Like he just grounded down the crown. And I didn't personally want to do it. To be honest, I feel like you get a really good education at, especially at the University of Florida. I know everyone's watching this from all over the country, but even from all your dental schools, they prepare you the best they can. And I actually had a couple of cases where I diagnosed trigeminal neuralgia twice. And the hardest part was finding a neurologist to do it because I ruled out everything. And, and I had Dr. Spencer before he left, but he's actually one of the, working in the pain clinic now at LSU. But he was a big Dawson supporter. For CE, when you get out, I want you to have the mentality of invest in yourself. If you see an endo course, and reps will come out to you and they'll meet you, especially if you're in private practice. I'm sure if you go into a corporate too, you might have to reach out to them a little bit. But reps will offer you a ton of CE. Like there's an implant company down here, and they were just throwing CE at me. I took one prosthetic course and always ask for a new grad discount. That's the first hint. Okay. Always ask.
So, like, what do you mean, like reps, like Henry Schein, Patterson?
No,
or
like Strawman, Astra,
okay.
Hyosin, Dent Supply. Dent Supply has their own company for endo, and they do CE all the time, and they'll send you information. And when you get into a new office, no matter where, if you're using the Wave 1 endo system, call the rep up, your local rep, and they'll come out and they'll teach you how to use your endo system, so you don't have to go in and learn it. Because I don't think they're teaching Wave 1 at UF. I know they're doing it at Kentucky and a couple other schools, but a lot of companies especially are using that. Private practice, some endodontists do a combination where they'll do Wave 1 in a Vortex Blue or different files. But those reps are really helpful, and they want you to know, and they want you to understand. And these reps, that's all they do is endo all day, every day, and they're seeing doctors do it all the time. So they're probably just as knowledgeable as an endodontist when it comes to using these systems. They just don't have a degree.
Yeah, I know. Yeah. My boyfriend is a sales rep, and I'm like, can you place the knee implant?
Yeah. Well, he probably could. He just doesn't have the legal issues. But I mean, think about it. If you've seen, thousands of root canals done,
right. You just, it
out. They can walk you through it. I mean, they can tell you, just, take the file and put it in this system, and then that'll back it out if it binds up so you don't break the file. All these little tips that they could, and they'll do it for free because they'll come into your office. So that's
interesting. I didn't think about that. So you're saying just call up some reps from these companies, implants, and they would be willing to.
Yeah, they'll be willing to. Yeah. Well, they'll teach you. If you guys have that system in your office, they'll give you the in down. Now with implants, obviously on the prosthetic side, they'd be really helpful for you. Just letting you know. Right. Like I had a guy save my butt because I had an implant locator case, and I needed. I was ordering the right locators, and that's something that you learn trial and error of measuring gingival cuff heights for a locator denture, and I had to reorder it, and he just hooked me up and sent me the right one when I really needed him to, so I could get the patient taken care of. But it's just, and that was a learning experience. So
does Spear, I haven't done an overdenture yet, and I've only assisted in restoring implants so far, 2 or 3 times.
Yep.
So does Spear go over that? And systems that we'll see?
I think they have over 60 lectures worth of implants dentistry alone. Okay. Prosthetics, surgery, and everything.
Measuring the gingival height.
Yep.
And removing the healing cat.
Yep.
Literally step by step.
Yep. If you just want to learn basic implant restorative, they've got it.
Yeah.
If you're going to learn implant surgery and stuff, I suggest you taking at least an 8-month, 9-month course that meets 3 days a month. and
Right.
goes through all. Like the one I'm taking right now is Implant Educators through the University of Florida, based out of Tampa, and it's
Oh,
incredible.
nice.
And they actually
That's awesome.
and they offer a really good new grad pricing. And so it's
Implant
almost
educators.
yeah,
Okay, because I'm going to be in Tampa next.
yeah, and
when
it's
I
like
start working.
30% off or something, and usually it's like $14,000. But think about this: $14,000 sounds like a lot of money, but think about how much money you would be paying for that AEGD or residency, and think about how much money you're going to be making. In sort of that sense, for me, it was all about trying to get ahead on my loans, and the AEGDs and GPRs are great. I've got buddies in the Navy that are just doing incredible surgeries. They're taking care of gunshot wounds. They're doing they're doing sinus lifts. They're doing everything, and they're getting this awesome experience of osteoradionecrosis. And I think it's an awesome opportunity to learn. It just depends on what you want to do and what you're into. Are you going to be seeing those cases in private practice? In the end, you got to be real with yourself. Are you going to do, really large lateral rig augmentations and lateral sinus lifts, or are you going to be sending that out? And those are some of the cool things you learn in an awesome AEGD or GPR, But at the same time, you got to realize, are you going to be doing that every day? Are you going to take on that liability and risk? Are you going to be comfortable enough? Because some of these people in AEGDs, GPRs, I know I've got a lot of friends within like their first couple months they had placed 5 implants, but I met people that were graduating from other GPRs and they had just done their first sinus lift or 2. So, I mean, how is that different than going to,
Yeah, which I still think you'd probably refer out.
Yeah, how is that different than going to a PICO Surgical Institute course for, 5 days and learning to do 2 or 3 sinus lifts in private practice? Granted, you might pay $5,000 for that course, but,
but I guess cost-wise, it still kind of evens out with what they get paid in AGs versus what you're getting making.
Yep. Now, if all that evens out, what else would you be learning in private practice? How to deal with insurances, how to deal with staff, how to deal with private practice and case presentation, how to build relationships with patients, how to build relationships with vendors. All these things are even taken into consideration. Some of the best things I learned are just, to write welcome letters and welcoming people into your practice from other private practices and different templates and, ways to work with your assistants and seeing how some doctors will do follow-up phone calls after, big surgeries with patients. Other doctors would get so busy and they wouldn't even care, but you would see the difference. You would see the difference in the relationships between the doctors and the patients. So it was really interesting to see that. But if you're working 4 days a week, or you have an off day, one of the most helpful things that I did is I would call up older doctors in the area, or I would just Google, some of the top guys that were in my area, and I would just call up their office and say, hey, can I come in and shadow you? I'm a new graduate, and I'm just trying to learn, and I have a day off. And most of the time, they say yes. You want to talk about some of the best continuing education at a zero cost? That is it right there. Not only are you going to learn some tips and techniques on cementing crowns or, interactions with patients, but I mean, they're going to walk you through, maybe what CE's around, what local groups to join, or, just teach you. I mean, honestly, patient interaction is huge. I've been shadowing doctors since second year of dental school, every time I was on break, but I mean, I must have shadowed at least 8 to 10 different doctors since I've been out in private practice, and I've gone and actually re-shadowed a couple of them because they were doing fun big cases. And man, that is some CE right there. If you see them, I saw a prosthodontist do $50,000 worth of dentistry in this patient's mouth all in one afternoon. And while I was sitting in there watching it, all the other associates were jealous of me because they had to go do work when they wanted to be sitting and watching me. I mean, this is a really big, awesome lab, large dental office. It's called Spodak Dental in Delray, and they are some incredible people down there, and they were just really nice to allow me to come in and shadow. But, I mean, their lab techs in there were making provisionals and relining, and he was just going to town, and it was just an incredible experience just to even be there to watch that. And it just tells me,
Right.
it shows me not only, how much more there is to learn. It's always a humbling experience to watch some guy prep an entire arch in 20 minutes. Uh,
Yeah.
but
So
but but
basically, my
he
question
teaches you a lot.
yeah, is okay. Say I have 8 weeks, 2 months before I go corporate. I have a feeling I know corporate's not really something everybody gets really excited about in the dental world, but I feel like I'm gonna probably start corporate.
And that's fine. And
18
no, and you
months.
know
Who knows?
what?
2 years.
Don't talk down on that. I'll
Right.
let you know, but keep going. I'll let you know my thing. But go ahead.
So a lot of times we have about 2 months even before we even start work after we graduate. So I want to maximize that time. So I guess shadowing older dentists. Like what else could I be doing in that time? Watching spirit videos. Like I'm really trying to be ready.
Yeah. So if you know exactly where you're going to be working,
Yeah.
that's awesome, because then what I would do is I would even reach out to the specialists in the area, and if your office is already established, figure out who the
Mm-hmm.
specialists are that they use, and go
Okay.
in and talk about shadowing them. Don't just meet up with them for lunch and have them like give you a spiel and see how things are going. Go in and actually figure out who they are as a person, and also see what type of work are they doing. And you could even pick their brain about that. And you want someone that's going to allow you to come in and shadow them, and you to ask them questions. That's a specialist you want to work with. If they're saying they're
Okay.
too busy and they just like, oh, let me try to go into lunch. Like I tried to shadow this endodontist guy that we work with, and he just wouldn't really give me a time of day. And then he said he'd set up a lunch date, and he blew me off for that. And I was just really turned off by that.
Okay.
But he was more so
Yeah.
insurance based. But get to know guys that are actually going to help you out. Like I met one of the great endodontists down here, and he actually teaches up at UF, Michael Elliott, and he reached out to me. He brought me into the dental meetings, because most of these guys are super involved, and they want to bring everyone else in because they're passionate about it. And that's how you can really tell, is if guys are involved in organized dentistry, it's not because, they want to put their name on the wall or the plaque. It's because they truly care about the profession. And if they care about that, then they're going to care about you, because you're the future of the profession. They might be retiring in 10, 15 years, but they want it to go on because it's what they did. So, yeah, when you're young, getting involved, go to the AEGD CEs. They usually offer them for free for students. Like there's a laser one in Orlando happening this Friday, and it's for free.
Okay.
It's for free for the entire
Great.
state of Florida.
That's crazy.
So I mean,
So
it's
AGD. Okay.
the Academy of General Dentistry. Being a member of
Yeah.
that is huge. I know there's a fellow track at UF, and Nova has one, and LECOM has one, and hopefully other states around the country are. And if they don't have them, they should hopefully set one up because the AGD supports it. But it gets you involved with CE, and those are some of the most motivated, groundbreaking doctors that I've seen for private practice, because they're staying involved and they're constantly learning, and they understand that importance. Right. Oh, going back though, it just sparked my main brain. It's good that you have that mentality that I want to keep learning and progressing while out in private practice, because when I was initially coming out to interview for a job, I reached out to my dream office, so to speak, and they had actually hired someone else before me because they thought I was moving somewhere else and they didn't know I was coming down. And they hired this guy. They're like, oh, well, he's been 4 years out. He was with this corporate office. He's from here. So we want to bring him in. They brought him in, and he didn't know how to, build those relationships with patients. But also, he was so behind on his continuing education because he didn't push himself to continue to learn with rotary endo even. Like, he got out 4 years before me. So rotary endo with him, they were just getting into it to teaching it at the school. So he didn't stay on top of it, but I was doing the CE, so I came out knowing the latest Wave 1 rotary which they had in their office, and he had never even heard of it.
Right.
Like I had pushed myself to take some laser courses and to start getting involved in implants, and he just got into corporate and just got with the grind and didn't continue to push himself and learn. So the biggest thing, my last video was license to learn, but man, you got to stay on top of that. But also, with my last video too, it's not all about just clinical dentistry, but the personal development and your relationships with your team and your patients too. And that's all stuff that you just learn on the go. But also, I mean, with reading personal development books, and you're gonna find it out. Like, yeah, we're in school, you're studying so hard, and every day can be exhausting sometimes. But if you're really gonna push yourself, you know, turning off the Netflix and being able to just set aside your study time. You can set aside your relaxation time. I don't know if you're married, if you have kids, that changes. That can also change the dynamic there too. But just setting aside down a couple hours. You got to think about these people doing residencies and extending their life for 3 more years, and that's awesome. And I think that's great if you're going to go back and get that type of education because you want to specialize in a specific field, and your passion is so strong for that type of dentistry. But I mean, if you love every aspect of dentistry and you're truly passionate about it, then you better make sure that you know how to do it and do it well if you are going to do it. I think it's the hardest specialty is to be the best general dentist you can be, because you have to be knowledgeable about absolutely everything.
Literally everything, yeah.
Yep, and you aren't just catering to the GPs to send you referrals. You are going out to the public and you're building relationships within the community. And you aren't just seeing those patients for just that implant or just that gum graft. And by no means, don't let this sound like I'm dodging specialists. I love my specialists. They're incredible people. They do awesome work. But, I mean, you are seeing these people on a constant basis. And, I mean, if something goes wrong, you're going to be there to fix it. So, I mean...
Well, today even, I got called over to the hygiene clinic, and they're like, we need you to look at something. And I'm like, okay, I got this. So I go over, and I'm like, I looked at it, and I'm like, it was like a pathology, a gum pathology, and I was like, oh... Like, I feel like I need to look it up and just, like, confirm. Like, and I don't know if that's, like, okay to do.
Yeah.
Right when you're with the patient?
Oh, yeah. Well, you know what? And you know what they also teach in pathology? If it's something that's suspicious, you always, give it 2 weeks, take a photo, measure it, and, and have them come back in 2 weeks and evaluate it. And you always show it to the patient, too, so they can continue to monitor it. But, the ADA... if you're going to the Florida Dental Convention or any of the other dental conventions, the ADA actually has an app for pathology, and they give you the code to download it for free. Usually it's like $50, but they give you like the free code at a lot of these conventions, and you can just look it up and type it in. And I have that on my phone, and I can just type, location, what it looks like.
You're probably gonna be not too pleased with this, but I've only been. I never joined it though.
No, you're fine. Yeah.
So at this point, should I join it like right now as a student to get better student rate, or like,
I think the ADA does free membership for everyone the first year, so you can still get involved in that. ASDA does have some benefits, and AEGD does have some benefits, like free malpractice for you your first year if you're going out into private practice. That was the challenge for me, and I'm going to share that on a different story. If you're going out as an independent contractor, you got to do your own LLC, your own malpractice, all that stuff. So corporate is helpful in that. Like you need your own health insurance. Corporate will give you more benefits like that. But for that, I mean, if you weren't involved in school like that, it's no big deal. But it's never too late to start.
Okay.
So just understand now the value of it for you right now and in the future. Don't stress too much about it in dental school. We're all just trying to get through it, and some people just have different passions and different things. But you've had these extra 4 years to develop as an individual a lot, which is cool. That's why I think grad school is also just a blessing in itself. Getting involved in the organized dentistry is huge for a new young doctor. The networking opportunities are incredible if you take advantage of it. And don't feel bad to take a Tuesday or a Wednesday off to go to a CE course, especially your first year out. The one quote that sticks with me was one of the smartest guys that graduated a class or two ahead of me. He said, I'm going to do this AEGD because my first year out is where I'm going to make the least amount of money, so I'm going to go ahead and learn. But, I mean, if you're already knowing that it's going to be your least amount of money, you could also, just don't stress about the money too much your first year out and take a ton of CE too. And you'll still, what's the worst that's going to happen? You're going to make the same amount of money as AEGD or GPR, no, you're basically almost guaranteed to make more, and
Yeah.
and you're going to get all those real world relationships. But the key is you.
Yeah.
You got to push yourself. That's the hardest part for me, even. So.
Yeah. Would you be do you have like a handful or a list of CEs that you could put on your page or something that you can
Yeah. Yeah,
like,
yeah, yeah, absolutely. I've taken I've taken quite a few courses, so I could post something. I'll do a little blog. I usually like to just to do the videos, but yeah, I'll write something up, and just like little things to get involved in, and some of the courses that I found to be yeah, some of that, but definitely the Dawson course step 1. They will do a new grad discount, and they do a big student discount too. But obviously, if your financials have to line up, make sure you're saving your money and not blowing it all. It's always good to have, some pennies in the bank so you can be fluid with your money here. Also, student loans is a totally different thing there, but I think your financial advisors are usually going to tell you to pay your least amount, do a pay as you earn, defer for the first 6 months, and then when you have to start paying, do income based for 6 months until your income's based up to a stable, at least where you can steady income, and then you can refinance it. But yeah, I can definitely post some CE courses. But a lot of it is, what you know or what you think you don't know, and then also where your passion is. I knew from when I graduated that implants were my passion, were a large passion of mine, and that I wanted to do them. So why was I gonna?
How are you liking that implant? Is it called Implant Educator?
Yep, implant educators, and I'm loving it. But down at Nova, they are doing an AAID course that's very similar, American Academy of Implant Dentistry, and they are doing like a very similar course. They might even have more hours though, and the cost is pretty similar. And it's just a different location, but they're all over the country, and they're sponsored by a bunch of different. You just make sure it's an international, or just a national implant education center that's sponsoring it, and make sure you're going to graduate with a certification, like a fellowship, because you want to. If you're going to do something like that, you want to make sure that you have that plaque, that piece of paper, that certificate that qualifies you for placing implants. Not just, I took some CE. Have that piece of paper for the whole CYA, cover your butt thing, because you want to make sure, like, you got specialists out there. They went to school for 3 years learning this, so they're going to say what qualifies you, and you can turn around and say, well, I took over 200 hours worth of implant surgery, and you got my certificate in this. And, that's just going to prepare you better as well, and that's what they do at the AEGDs and GPRs. They're going through that exact same course that I'm attending.
Right.
So it's really cool. Like that's the implant course that the one that the Seminole campus takes
awesome.
In St. Pete. So it just depends.
I feel like I could probably talk to you all day, but I do feel a little bit more comfortable now stepping out on my own, and knowing there's things I can do.
Yeah, and there are things that you can do. The most important thing is to just make sure you push yourself and don't become complacent. Especially with the best advice I can give you is don't become complacent with where you work. If you feel like you're just stopping and you aren't learning, or if you feel like your doctor is trying to teach you something and you know deep down in your mind and in your heart that it's not right, you need to be looking and progressing and moving, and don't be too afraid to leave that, whatever it might be, stable opportunity to go look for something better. Because the best advice I can give you is once you become complacent in private practice, especially when you set out, first off, when you first graduate, once you set that bar, it's really hard to set that bar higher. If you set that bar low and you let your quality of dentistry slide, or if you get complacent, it's going to be very difficult for you to make a change and bring it back up. So you're graduating from like a wonderful education from all over the country. All of the dental schools are great, but you got to hold that. You got to hold yourself to the highest standard. If you don't, you're just gonna slip. Your patients don't know what your crowns are. Your margin. They don't know what their margins are. They don't know what cementing technique you use. But you know what you're taught. And let me tell you what. The doctors that have been out for 5 years, they're still cementing the same way they did 5 years ago. They aren't doing it the way they're teaching you now. So it's up to you to take that extra time and not just fill it and slam it in, to do it the proper protocol and teach the assistants to do it so that it'll work. But the biggest thing is don't get complacent, because that's just going to be your downfall. If you're motivated and you want to keep growing, you just got to do it. And the best way to do that is just by shadowing and meeting all those different doctors, because you'll see where the standard is. But that's probably one of the best things that I've learned, and I'll share with you my story later on about that. At another time.
Okay, thank you. Yeah, I'm feeling better about it. I'll literally probably be signing for the corporate position here in the next week or two. So I'm just like looking for anything to make me feel better about the fact that I didn't do an AEGD.
Yeah. So don't feel bad about it. And I would even approach the corporate company and say, hey, this is a continuing education opportunity I'm looking into, and I'm looking at paying for it. Would you mind helping pay for it? Because I know there's a corporate dental office or company down here, and they actually pay for all of their dentists to have Spear education. And
that's awesome.
Yeah, to have the CE. But not only that, Spear education has awesome patient education videos. So you could put it on an iPad or a laptop and have it explain the procedure, or you can do printouts. And so you can even just tell your hygienist, hey, go turn on the perio video for the patient, and it can explain it while you're next door. And then you can go in and follow up, and it's a visual, and it's incredible. And I'm going to start doing that now with my patients, and they seem to really respond to it for the couple of ones that I've done. But my first treatment plan I did was $5,000 implant overdenture case. And the reason I was a new grad, like very first treatment plan case, and I did everything I could. I diagnosed him. I told him to come back, and I did the treatment plan. But I had printed out the procedures, like the step by step, and that's already in there for Spear. Like they took the video and they verbalized it onto a PDF for you. So I just printed it out and gave it to him to take home to his wife, so it would explain what we were doing, and it was perfect. So. But
awesome.
Yeah, it's
all
helpful.
Right. Well, I'm feeling more motivated.
Yeah, absolutely. Well, that's my goal, is to keep everyone motivated, because I know it can get crazy and it can get down and it can get confusing because you don't know what you're getting into. But if you're motivated and you're passionate and you're gonna really push yourself, and that's the hardest part, is just constantly staying on top of it. You gotta build a schedule and just always think, what can I do to get better every day, and did I get better?
Yeah.
So.
Definitely. And, okay, so you'll post some information about, like, a couple CEs that you kind of really hit home for you that you like.
Yeah.
And then, okay, cool. All right, awesome. Well, thank you so much, Patrick. I appreciate it.
No worries. You're welcome. It was a pleasure chatting with you, and if you guys need anything else or have any other questions, feel free to shoot them my way. I love to help out.
Yeah. I appreciate it. All right, I guess I'll be talking to you later.
Sounds great. Take care.
All right.
Good luck on boards. Bye.
Thank you.